Hey, can you hear me? Yeah? Welcome everybody, good afternoon. It is my pleasure to welcome you to this event organized by the Amsterdam Research Center for Gender and Sexuality, RGS, as part of the Amsterdam Institute for Social Sciences Research, and of course also this beautiful location in the heart of Amsterdam, Spui 25. My name is Sarah Brakke, and I hold the chair in Sociology of Gender and Sexuality at the University of Amsterdam. And I direct the Amsterdam Research Center for Gender and Sexuality together with Julie McBrien, who would have loved to be here today, but unfortunately she is not able to. RGS is a research community. We seek to bring together scholars and scholarship on gender and sexuality within the Amsterdam Institute for Social Science Research. And this community is shaped by many differences. Differences in disciplines, in disciplinary traditions, in theoretical and epistemological approaches, different methodologies, and also differences in the emphasis on gender or sexuality within one's research. And we are committed to make this an expansive community where those differences provide fertile ground for conversations and new ways of thinking. We currently have 2 lecture and sometimes still webinar series, Thinking Through the Crises, which engages with different kinds of contemporary issues and crises that we are faced with, and explore these crises from a feminist and queer perspective. And then the second series is called Research in Focus, focusing on new exciting research. And obviously there's an overlap between these 2 series. So check our website, check our active PhD community, and join the newsletter to stay connected. Now, as a research community, concretely, we bring scholars together for more than 10 years now. But of course, in the past 2 years, this bringing together has taken drastically different forms in a pandemic world, where the urgency of community was felt more than ever, and at the same time, the difficulty to actually organize community, to come together. And this gathering today is also an example of that, right? I think this might be our 3rd or 4th attempt to gather in real life. Lots of laughter there. With the last attempt scheduled in December, which we needed to postpone because of what was called the lockdown. There's a discussion on that. When I saw that and when I say that in these conditions, and conditions of the pandemic, which I have already invoked, but I think there's other conditions to invoke as well, and I am very curious about the presentation today, but I wouldn't be surprised if we would also be talking about conditions of war. So in these conditions, I think we both feel the urgency to meet and the difficulty to meet, as I said. And it is also about, not only about meeting, but about meeting on our conditions, right? We could have met online in December, and it was a deliberate choice not to do so, but to meet in real life. And I'm sure that today we will learn more about such choices and the stakes in such choices. Now for RGS, this is our first gathering in the year of 2022. So we're opening the spring activities today with a wonderful spring sun. But also, as I already mentioned, in a context of war, where there is a lot to think through when we think about infrastructure as well, and when we think about technology. And so the painful condition of war, and also the painful condition of our differentiated responses to zones of war and conflicts where human lives are and livelihoods are destroyed. So the kind of wars that we get sucked into effectively, and I'm using a kind of a general public Dutch we or European we, in relation to other destruction of human lives and livelihoods where the common sense, the common affect is constructed differently. I don't know if there will be time to go into that, but I can also imagine that would come up in our discussions thinking about infrastructure. Now, before actually moving up to the topic of today, computational infrastructures, and indeed technology in the public interest, I would like to backpedal a little bit to the start of this lecture series. So this is the Thinking Through the Crisis lecture series, which we began in September 2020 as our first activity in the pandemic conditions. So that was actually our first webinar at the time. And this Thinking Through the Crisis kickoff webinar was with Titi Bhattacharya, the brilliant theorist of social reproduction theory, with a lecture on social reproduction theory and essential work, and the discussions about what is essential work as we knew them at the start of the pandemic and the lockdowns. Now, in that discussion, in that first webinar, we ended up talking about infrastructure. So we began with essential work. We began with the question of care and social reproduction and how that is organized in our societies. And in the span of an hour and a half of the webinar, the last half hour, we talked about infrastructure. And one of our colleagues, Christine Krause from our anthropology department, used the expression infrastructures of care and also caring infrastructures. I think we used both. We went from infrastructures of care to caring infrastructures. And I would like to go back to that moment, given that it seems to me that even if the topic or the field that we are talking about today, technology, computational infrastructures and so forth, and the digital world, even if that seems to be quite different from questions of care and work, at the same time, it seems that the impulse of our discussions is really quite similar, and that we will probably come back to some of these discussions on caring infrastructures in the context of the topic of today. Now, I think that I also want to note, because it's something that we need to keep on having in mind as we're thinking of creating these scholarly communities, that it has been more difficult in our gender and sexuality studies community to get people motivated to think about technology or about the digital or about computers or computational infrastructures. As we were preparing this event of today, I was checking in, for instance, with our PhD communities and asking, okay, who is working here on questions of technology? And there is a first reflex of, oh, that's not really what we do in gender and sexuality studies, or not many of us, or I don't know so much about technology. These discussions are out of my realm, which is precisely the reason why with RGS we found it important to have an event like this today. At the same time, I also note when I look at all the friendly faces in the audience today that a part of our usual gender and sexuality studies audience is not here. So the disconnect continues, but we keep on being motivated to make sure that we integrate these discussions, and that within gender and sexuality studies we're not only talking about infrastructures of care, but infrastructures of technology as well. We do need a little bit of help for that, and that is why we have these wonderful speakers here today, who could maybe also connect with some of our discussions, but we can do that later on in the Q&A. Like, indeed, how would caring infrastructures, how would that look like? Maybe we can have a conversation there. But first, we have a presentation by the Institute for Technology in the Public Interest, TTP, TTP as we can call you, with the title Small C versus Big C, How Computational Infrastructures Capture Technical and Social Imaginary for Public Life. And let me just say a few words about TTP before passing on the mic. So the Institute for Technology in the Public Interest draws on feminist, decolonial and intersectional analysis, and has been studying how infrastructural shifts are changing institutional conditions that impact feminist organizing and the lives of marginalized communities, including people of color, women, trans and non-binary people. TTP is a trans practice gathering of activists, artists, engineers and theorists, and has been initiated by Miriam Aurach, here next to me, Seda Gürses, yeah, you should probably wave. So Miriam, Seda Gurses, Helen Pritchard, the second one, yeah, and Femke Snelting on the far left, right? Together we convene, together TTP convenes communities to hold computational infrastructures to account and to create spaces for articulating what technologies in the public interest might be. Also taking into account that the public interest is not simply something we can take for granted, but is always in the making. So there's much more to say about TTP, but you have the best people here on stage who will actually introduce you to their, what I consider to be very important work. So without further ado, thank you for being here, and the floor is yours.
Thank you.
Thank you.
Thank you.
All right. Well, wonderful introduction. Thank you, Sarah. And gratitude goes to you and to others at University of Amsterdam who have continuously rebooked our hotel and train tickets, and to Spau, who was very flexible and accommodating. And to all of you who are in the room with us, thank you. It's a sunny day. It's a spring day. We're just coming out of the COVID winter. So it's especially appreciated that you're sitting here with us. I'd just like to start with saying we're super excited to be here, and we can consider both the Institute as well as this gathering today a trans-practice gathering, meaning we come from different practices, disciplines, experiences, political motivations, etc., which brings me to a very important point I'd like to make about the rest of the session. Sarah read the title of the I don't want to call it the talk, the event today, the gathering. I'll read it again, okay? Small c versus big C, how computational infrastructures capture technical and social imaginary for public life. Now that's a lot of words, and what I'd like to invite you to do, because we like a lot of words, but we also like our practice, we'll spend the next few minutes unfolding our practice for you, both theoretically and in practice. However, it's very possible that we use words that you don't know, and it's very possible that we use words that you do know, but in different ways. So this talk can only, or this presentation can only make sense if you join us in both questioning the words we use because you don't know them or because you want to know about how we use them. So we'd like to invite you to just chime in at any given moment. We'll try to be slow and to explain each and every word, both in the kind of framework that we use them in to inform our theory and practice, but also as we unfold the example that we have prepared for you today. On that note, I'd like to give the word to Miriam.
Yeah, thank you. Thanks for the warm welcome. And indeed, I think this was, 8 months in the making. And your title of the series, Crises, plural. The last time we couldn't get together was a major crisis, still ongoing, COVID and spread and infections and lockdowns and what have you. But we live in a world with multiple crises, and we wanted to start also by acknowledging the time we're living in, the moment we're in. We were having discussions among ourselves, especially people who have connections in countries that are at war or have civil war. The political is very personal. And so we thought, should we not change the whole approach? Should we not? So we thought we'll do both. We'll do our intervention, our talk, but we also pause and we also, acknowledge this horrible time we're at. And so we're not going to skip the elephant in the room. We're not going to do a John Cleese, don't mention the war. But yeah, we've, the four of us, and I'm sure many of you have spent many hours watching, listening to the news, pulling your hair. What can we do? The last few days also realizing that the war in Ukraine and Russia could go into nuclear levels. So this is all very real. So we wanted to acknowledge this and share with you our own frustration, our own sense of urgency, and how sometimes it also makes it feel like all the other stuff you're doing is a bit senseless and what's the point. So we wanted to begin with that, and also to share that we also have thought about what can we do. And there's a lot of discussion always, particularly in places that are a bit remote from where the actual war is going on or the actual action is taking place. There is a sense of frustration at what can you actually really do. Of course, the reflex is to think very directly, and then you feel frustrated because, you know, you're not there, you're not. So we wanted to say that we understand that there is actually not much we can do on the direct level, and that is something that we need to also come to terms with. That, you know, it's not the times or even the privilege of the romantic stories had of the Spanish Civil War, where people would go and join the... No, we shouldn't think on that level when we think about what can we do, and then conclude, oh, well, we can't do anything, when you answer that in the negative, right? We need to think about other ways in terms of what we can do, and we need to also think long term. What are the causes? What's... is it me? Oh. Maybe some Russian hackers have joined us. What are the political, economic, infrastructural causes? What are the institutions? What do we need to dismantle? What is the undoing we need to also engage ourselves with when we think war in the long term, so that we're not strangled in the urgent moment and think, well, we can't do anything on the short term. Some of us have grown up and know that this is not the first time that, oh, the war is in Europe. Some of us have grown up knowing Bosnians, knowing Serbs, knowing others that were also next door, let alone, and I'll choose my words carefully, let alone, of course, the refugees and political activists and people in exile we know from other regions that are dehumanized to the extent that we need to use our words carefully in the media to even mention that they are also civilized. So there are two things we can do, actually three things, what we want to propose. First of all, you have seen thousands of people have taken to the streets within the space of, I think, 3-4 hours in Russia. We've seen images of big cities, small towns, where there was an enormous bravery of Russians who refuse the logic of war. So one thing we can do is we can support opposition groups, anti-war activists in Russia. Well, how can you support them? Don't be discouraged by the sense that the only kind of support is, for instance, sending money or sending goods and things like that. Of course, if there are direct links between organizations here and there that you know of already that need support, of course. But there's other ways you can support, and that is to amplify their voices. Their voices are erased, and that is also because mass media, corporate media, but also hegemonic politics, they have an interest in maintaining a binary, evil, good, etc. So the oppositional voices within both are erased. So amplify their voices. There have been amazing pieces by Russian activists, Russian anarchists, anti-nationalists, anti-chauvinists, etc. Amplify those. Use those in the classroom. Send them. The second thing that is related is amplify and support the efforts of progressives in the Ukraine. There is a strong tendency, and every war does this, to deepen chauvinism, to create hatred, to also strengthen nationalism. And we've seen that Ukraine, in the past years, has had a very disturbing development of far-right groups and fascist groups. This is a very rich breeding ground for them. So support those people in the Ukraine who are also talking against it. The counter-hegemonic voices in Ukraine amplify their voices, share their pieces. If you know journalists, if you know academics who work on this, encourage them to interview those people, to center their voices, right? And the third thing we can do, but we have to do what we want to do. We hope that you will join us in this ethics, but what we share in our moral approach is a kind of sort of the approach of Rosa Luxemburg, to understand that the enemy is at home. We need to question our own state. What is our state doing? How has our state made possible or facilitated the moment that we're in now? What do we do with regards to militarization? What do we do with regards to NATO? What do we do with regards to borders? And so we demand, for instance, that the open borders in which we welcome refugees from the Ukraine are, first of all, real. I live in Britain, Helen as well. We can tell you there's a lot of, excuse my French, bullshit. When Boris Johnson says, we welcome all, that's not true. We welcome Ukrainians when they are also willing to do some seasonal picking in agriculture, the conditions, right? So we need to be aware that we hold accountable our states when they say, oh, we welcome all refugees. But we also want to welcome other refugees. So we also want to tell our states that are now suddenly discovering that the infrastructures are there, the will is there, to say, as we welcome our friends, brothers and sisters from the Ukraine, we extend the exact same warm welcome to the refugees from Afghanistan, from Syria, from Kurdistan, from Eritrea, from wherever. We do not distinguish. And, you know, choosing my words carefully, it doesn't matter if a refugee has blue eyes or blonde hair. All refugees are welcome. And this is an opportunity for us to do that, to ask and demand that from our state. You said you welcome Ukraine? Why not? This is a moment where you can bend that stick. So those are the three options that we want to offer you after we've discussed this, because we notice that a lot of people ask, but what can we do? So this is what we would like to share with you, and that is part of our praxis as the Institute of Technology in the public interest.
We've also been looking at the role that technology companies are playing in the war. As many of you may share with us, we may be at the brink of yet another massacre or a genocide, which we know that both the EU and the European states have had a bad track record with to reacting in time or taking responsibility or providing accountability for. And what we see now, the first weapon or the first approach, let's say, that governments have taken is to consider doing whether there will be a cyber war and how they will retaliate. And what we've seen is a call for cyber warriors to take action in this situation. Now, given that computation and computational infrastructures, and by that I mean both the cloud infrastructures, and if that's not known to you more than your iCloud or Google Drive, that's fine, that's kind of what it is, and mobile devices as their accessories, signaling the end of the personal computer to devices we carry in our pockets that are carefully managed through these cloud infrastructures. Since these technologies have become so infrastructural, it is already happening that governments are turning to tech companies, going beyond the cyber warrior madness, which I find very problematic, to asking tech companies to take action. And we've seen some of this, for example, in the case of the Ukraine Minister of Digital Transformation, asking Elon Musk for Starlink access. Starlink is the internet through satellite that Elon Musk is invested in and is currently putting into practice. We've seen that Oracle moved out. We've seen that SAP and Apple have stopped sales, although they continue to support existing services. And there are calls for further action from these technology companies. Now, what's interesting about the computational infrastructures that we study and we try to create resistance towards is that the companies that are running them, and there are just a very few, have concealed their infrastructural power very much in the past. So the talk about sanctions is going to be very interesting because big tech companies can play a very, very massive role in undoing existing infrastructure in Russia or keeping infrastructure going in the Ukraine. But they will probably shy away from that because taking those actions will lose them customers in the globe, right? So they will have this very fine line of concealing their infrastructural power while also putting it to use. And we wanted to think about this because so far in the public view, these tech companies have been doing what we would call content moderation. So removing posts that are associated with disinformation or removing news channels that spread such news, like RT or Sputnik, removed from the European App Store. We wonder what happens in all the other regions where RT and Sputnik are still being made available. So we're very curious about how these tech companies and their computational infrastructure will be invoked in the context of sanctions. If we or they understand the consequences of this, how we're to assess it, and what should be a critical anti-militarist position towards the use of computational infrastructures, both in war and sanctions. Now, we don't have the answers, we just have the questions. But we really hope that in the rest of the talk, the example we give will be based on what was known also as immunity passports or QR codes. And I hope that by giving another example, which was very much tied to these computational infrastructures, we can open what could be positions and practices that could help us answer some of these questions, because they're absolutely urgent and they'll be answered by tech companies because they've already been, right? They've already decided what is risky enough and what is not risky enough to take as sanction measures right now. And it'll be interesting to think critically about where we stand on this, given the immense power that these companies hold also in Russia and Ukraine.
Yeah, so as Seda was just saying, you know, these, the big tech companies, these computational infrastructures are very good at concealing their power. So how do we start to engage with that? How do we start to address that, push back against it, without feeling the kind of overwhelming kind of fear when we're kind of faced with those infrastructures? So if we think about some of the ways in particular that feminism has engaged with the digitalization and computation, of course we can think about, you know, the kind of core of that tuning to the digital has really focused on algorithms and individuals. And at TTPI, we are trying to shift that and trying to make a shift from that focus on individuals and algorithms to thinking about computational infrastructures. And in particular, we're kind of working on collective articulations, so thinking about how to articulate some of the ways in which that power is concealed, the types of activations that we might engage with collectively, and also the reimaginations and the transformation that might be possible. So one of the things which we're working on in particular is really thinking about the transformation of institutions by computational and through computational infrastructures. And in particular, when we're talking about these transformations, we're talking about the transformations which are the development of apps and services for the operations of institutions. So the way in which institutional operations are being captured by computational infrastructures, and how this is leading to really a kind of depletion of operations, of knowledge, of imagination, and also the kind of creative possibility to resist that, right? So that not just a depletion of the resources to operate institutions, but actually a real kind of depletion of the possibility to creatively resist and respond and have an otherwise. And in particular, when we're going to be talking about computational infrastructures, we're referring to this big C, which is in the title. And by the big C, we're referring to the cloud, which we're going to talk a bit more about, and also how the mobile as the kind of accessory of the cloud.
So the slogans you see behind us are a collection of these very raw articulations of trying to have ways of speaking back to these infrastructures in ways that are not trying to stay away from this obsession and focus on individual relations on the one hand, and on data and algorithms on the other. So there are really different ways of trying to speak about the way that infrastructures are woven into many different structures that we live in and live with. And it's one of the many ways that we are trying through our by bringing together our different practices to keep with our commitment to not just critique the big C, but also to work on imaginations of what a small c would be. And this is not a simple solutionism. It's not trying to find a solution for the problems that we see with computational infrastructures and how they change the operations of institutions and organizations that are vital for the way we have a public life. But it is to try and think about methods, tools, words, ways of speaking, ways of spreading around memes that would somehow help us to articulate, keep articulating and keep activating ourselves and others for other imaginations of technology. And our stance is absolutely critical but not anti-technology. That's, I think, really important to keep in mind. So we're really trying to think about what practices and what types of technologies and what types of relations between institutions, people and technologies would constitute this small c. The reason, the raison d'être of TTPI is that we found scarily little tools and ways to do that around us. And we were struggling to develop those tools on our own. So we really needed to come together, to gather as a trans practice gathering, to start working on those tools. And the example we want to talk about today is one of those trying to find modes of formulating critique in a way that is not stopping with the critique but goes towards other imaginations. So the example we will talk through seems already a lifetime ago. And the stories start with the moment that the European Union was about to launch what now is referred to as the Corona Pass, or the QR code, or the digital immunity certificate, or in Belgium, where I live, they would call it the COVID Safe Pass. So there's all kinds of formulations for trying to name what this actually is. And the thing is that we realized that in the discussions around this pass, there was surprisingly little attention for the infrastructures it was actually invoking. And this is where the example starts.
So, April 2021. It's really hard to count your years during COVID, but it was till about a year ago, okay? So this is the moment where the EU was drafting a regulation. At the first moment, it was called the Digital Green Certificate. On the insistence of activists and others in touch with the parliamentarians, it was eventually called the the digital COVID pass, to ensure that the same regulation would not be repurposed for another pandemic or another global situation. It was to be voted in May in the EU Parliament. So this was the background in which the Institute was having one of its first gatherings. By the way, the Institute came to being as a bug report to the contact tracing apps, which was, so to say, the first moment governments kind of turn to this kind of known digital transformation, which is we must use apps to do government services. In this case, it was for public health. So we came to being as a bug report, and we'll explain what that is in a moment, to the contact tracing app. And it was kind of funny that 1 year later, we were having this gathering, and the idea of a bug report started circulating again. But let me say a little bit about the gathering. So we had already been having a series of conversations from November on with organizers, activists, anti-fascists, designers, about the impact of computational infrastructures on organizing, the relationship they have to institutions, and how these institutions are being transformed by things like apps or new services during COVID. So we had this 1 week gathering during which, in the background, the Green Certificate regulation was being discussed.
So in these conversations, we started to see how schools were switching completely to commercial platforms. I mean, I don't have to explain, you probably we've all seen it, but this was the first moments that we actually started to gather these stories and started to somehow understand the scale of computational takeover, infrastructural takeover. So for this 1 week workshop, we brought together 15 to 20 people from very different backgrounds, some like migrant organizing, anti-fascist organizing, from like different ages, different relations to technology, different experiences with oppression. So very, like not a homogeneous group. We were trying to somehow weave those different accounts that we had been gathering in the conversations by bringing those people in the same online room. But in the meantime, while we were preparing these workshops, we were in our meeting, so between the four of us, we were also getting reports from SEDA, who was at the same time in conversation with EU people about how this certificate would be implemented, engineers that were trying to settle for what standard to use or what technology to develop for it, and what security and privacy considerations there might be. And we realized that this was actually something that we might, with this group, want to address. So, a bit shyly, because we were actually barely grasping what was happening, and also realizing that that regulation that was in preparation at that time was about to be voted in, so that there was not much space for
a public discussion.
Yeah, for a public discussion, and also that it was very clear from the first research we were doing that it seemed that the European Union was not making any impact assessment. So they were not really thinking through what the consequences would be of implementing something like a corona pass. So we used the last Friday afternoon of the workshop and invited the people that had come to meet each other to join us in what we called a bug reporting session.
Yeah, so the...
Yeah, maybe this is, like, I see people nod. we were curious to hear from you. I don't know if someone would want to say something about, like, whether you were aware that, or whether at that time you remember any discussions about the, let's say, infrastructural implications. So not just about what the past would make possible or not, but also what the institutions, how the institutions would change, or how organizations would have to adapt, or what the long-term effects would be. Is anyone, like, remember any conversations there, or? So it seems a long time ago. Yeah. Okay. But there's a microphone, so I think it will help. Thank you.
I only remember a short discussion in the Netherlands during the contact tracing apps,
yeah,
on how to store data, how to deal with privacy issues in getting a message you have been in contact with someone with COVID. Mm-hmm. But this was a very short moment, mm-hmm. and I also remember it got overruled kind of by, well, oh, the government sucks, let's do it commercially. Mm-hmm. It's the vaguely how I recall yeah. it.
I actually remember the lack of infrastructure, that you would come with this QR and then a marchusei in France would look at it with a lot of importance and decide whether you can pass or not, while, you know, the whole platform is, they didn't have scanners or anything.
Yeah.
Yeah.
It was emergent. Yeah.
Like, I think what I was missing on the discussion was that it's both the Green Pass and sort of the contact tracing app are both sort of security theater. So we offset a lot of sort of ideal notions of what we think works to infrastructure and to companies, whereas in the end, well, now, I mean, then it was already questionable, but now we also know that reality's caught up.
Yeah.
So in Italy, there was kind of a discussion in deciding whether to make, you know, like a stattal platform, an app, and they actually made it afterwards, or to use to delegate such task to Google, for example. And then there was whole discussion about, you know, like the security measures, of course, yeah, involved.
Yeah, so we realized, you know, that there really wasn't much space for this discussion to be happening. And it's also something that we'd really seen when the contact tracing app was also kind of proposed, which was the moment where we had written the first bug report. So, you know, we kind of thought at the end of this week, as many of the stories were coming up, as people were navigating, kind of living with COVID, the way in which their institutions were responding, that actually the Friday, as Femke was saying, would become a bug reporting workshop. And this method of bug reporting workshops is an approach we've been working on. And it's a form really of developing a kind of public method, or a kind of doing research together in public, as a way to create a kind of collective articulation that can actually both provide space for working out how we feel about some of these technological developments in computational infrastructures, but also finding a way to kind of bridge really between us and the people that we're working with, and the kind of big tech companies or the engineers who are working on these projects. So bug reporting, as probably some of you might know, has really been kind of building on that tradition of reporting bugs. And for over a century or longer, inventors and engineers have used that term bug to refer to mistakes or errors in a system. So when something's not working, somebody will make a bug report. And in that technical tradition, the document works as a kind of, to look at the way in which there's a kind of things might fail, to perhaps even look at kind of mishaps in the code itself, or also to report on things like the returning of an error or the stalling of a technical system. So bugs and reports have really become quite a fundamental part of making, and the way in which things like the certificate or the contact tracing app actually kind of emerge into public spaces. And they're also really a big part of the continuous way in which people make and remake and reimagine what computational infrastructures might be. However, what if we actually start to recognize a bug in the system that's not technical? Where do we report that to? Where do we place that issue? You know, the way in which the bug reporting has really kind of emerged is certainly kind of not necessarily making the space for that. And then on top of that, what if the bug that you want to report is actually the system itself, the whole infrastructure? You know, what's the space to do that? So this is a kind of way in which we've been playing with bug reporting, so to use that existing form of reporting a problem, an error, a concern, but instead of kind of putting it out there, I don't know, as a blog post or a tweet, actually submitting a bug report to within the spaces in which the certificate was being made or the contact tracing app was being made. And so, you know, the other thing is as well is, you know, what if the system in the making is actually part of the problem, not just a kind of technical problem or the kind of the discussion of whether that technology is going to improve life or not, a kind of solution. But actually, you know, what if it's part of also reproducing things like racial capitalism? You know, where can we report that to? Or if it relies on the extractive infrastructure of computation, which is something that we've written about, kind of trying to think through the ways in which these infrastructures are, you know, really, really dependent on extractive systems. So, you know, this is kind of, I guess, the kind of play of the bug report, is to use the bug report to maybe report on things that are perhaps slightly impossible to report on, but very complex to report on, to also kind of report on something into a system that actually is designed around an issue that then gets solved. So, you know, what is the way in which that the people who are running that GitHub are going to solve this issue, you know, actually kind of proposing that to them.
Yeah, so yeah, this was partly an experiment for us and partly also a crucial intervention. And so, you know, bringing it all together for us, for the Institute, the bug reporting praxis as a methodology that we kind of also developed along the way and then adjusted and refined and polished. It really came down to trying to collect and collate a set of observations, materials, analysis of issues, but also the problems and possibilities that come with computational infrastructure. It's almost like a sounding board that you kind of throw everything at it. It's actually pretty scientific in a way if you think about trial and error. So very holistic approach that also for the bug reporting would include as our material, as our, you know, in social science you have this distinction between primary sources and secondary sources, and to actually not make that distinction, to actually think of technical plans that are available, policy documents, but also newspaper articles, diagrams, and of course the discussions we have with people, whether they are users, technical experts, political activists. So the process itself is very, very important, rather than the trap we often find ourselves in, particularly also as part of the critique of the Institute, that we've also sort of discussed in previous contexts, such as the Arab uprisings and other moments, where we are aware of the problem of trying to find a solution. This is a crisis, it's now or never. So rather than doing well, let's get things done first, and then we will discuss what the consequences could be, what the risks are. So instead of first finding the answer and then seeing whether the answer is to actually stop and pause. Obviously, everybody will remember, and it still is the case, I think, that with COVID, that sense of now or never, or that moral binary was we also had the experience where we would sit with people and they would be, but so are you saying that it's not serious then? So are you saying that we shouldn't have then a tracing? Is that what you're saying? So the kind of attempt to stop and to say we need to ask questions, we need to bounce back and be holistic about it. So what was really important also was that neither for us, for TTPI, nor actually the people in the group that we worked with and that joined the meeting, there wasn't really a very clear consensus or a very clear answer. You know, it's another thing you discover, that you need to allow that space, that it's not either or you have the answer or you don't have the answer. So it wasn't like a very clear consensus. How do you think about, where do you stand vis-a-vis the regulation? What are your conditions in how it should work or what it should do? And of course, that is, in a way, it is in the nature of a pandemic. And that there is this kind of now or never, yes or no binary, right? And there has been, of course, a certain discourse in the debates also with the technological infrastructures that so clearly relate to health and well-being. I mean, that's in the nature of the pandemic. That's just what it will gear you towards. I mean, in the UK, the app is literally called the NHS app. I mean, talk about also how hegemony works, right? And what kind of binding relationality it creates. So we wanted to, again, ask you, because that's also what we've been doing with the book reporting. The asking questions is almost as important as, you know, formulating them in good ways. And so we wanted to pause again and ask you, if you remember, and also maybe very recent, because I think in the Netherlands, at least, you are now in a moment of transition, right? Some people are still like, not sure. I saw when we entered, a lot of people in public were asking, QR, like it's still, we're kind of in this moment of like, is it not? Does it mean that the pandemic is over? Or and it comes from like genuine concern about solidarity and accountability towards one another. And so we wanted to ask you how the introduction of the QR code here impacted or changed your relationship with public health institutions in particular. For instance, I mean, I don't want to put words in your mouth, but we were thinking, for instance, about, you know, also in discussions we had about how come so few or so many people are willing to, for instance, the vaccination or the app. Why instead of informing the public, to inform the public about, for instance, the pros and cons or the nature or evolution of the virus, the contradictions that come with also, instead of informing the public and in that way enabling the public, that it was very much enabling the public merely by offering the app. So that was kind of like the way healthcare institutions intervened, offering the app to check rather than informing in a certain way. So there are different kinds of critiques, right? So what is your experience, or how has it impacted your relationship with public health institutions, directly or indirectly? It could also be because, I know there's some medical anthropologists here, it could also be how we talk about it with students or with other people. Does anyone have a... Yeah. And also the people online that are watching, 125, right? How many? 125. Oh, still? Okay. All right. They can also send questions.
Okay, so I'm just going to speak for Greece because I'm for Greece, but I've been here since September. I have to tell you that I think the percentage of people who got vaccinated is like 50-50 or 60-40. And it's just so weird because most of us have lost our trust in public hospitals and everything, because people would say, for example, that somebody got tested negative, but then they enrolled them as positive, and there were so many cases of people who were unsure about it. But when you're like the vast minority, I would say in this case, for example, maybe in the Netherlands, I'm not vaccinated. I think I was one of the 3 people I knew here that were not vaccinated. And I was kind of disappointed by other people of my age because they never questioned it, like the fear of missing out or being in your house and confined in a very small space for a long time. People just wanted to get vaccinated so that they could travel, and I don't judge that, but from the other hand, I don't think I received so much support, like people telling me, why can't I go there? Like, why can you go? What if you have COVID, but I have to get tested? So I'm very happy for how things unfolded. And I have to tell you, for many people in Greece, we've lost a major part of our trust in the public hospital system we have, and other people can also confirm it.
But maybe to also ask about like how you feel like this, like I see in Belgium, for example, that's been an extreme push for e-health. So where before you would go to a doctor, you get a piece of paper that you could then bring to a pharmacist to get medicine. By now that's over. So you just take your digital ID to the pharmacist, and the doctor has sent through your ID your prescription. So that's quite a shift, because it means anyone without papers has no way of getting medicines that they would need or have a right to get. So this shift for me, for example, was really clear that through the way that the apps were working, this was also shifting our expectation of how we interface with health institutions. So that's an example, for example. Well, right. But
yeah, there's someone in the back. Make it a bit dark, isn't it?
Yeah, I wonder if I look at my own environment, I wonder if it really led to a different relationship with public health institutions. I think it led to a different relationship with other people and with the state as an entity, because for many people the QR code is not an extension of the Dutch public health system, but it's an extension of the state. And so I think that relationship changed a lot, like for some people positive, for most people negative. So I think it really depends on the country. I was just in Austria, it was also the state primarily. It's like, yeah.
So I work in a small city up north from Amsterdam, and there's a lot of graffiti there saying like IVD is GGD, RIVM is like all the various branches of the public health. Oh, sorry, I'm not doing this correctly. The intelligence agency is also the public health services. The Center for Disease Control is also the intelligence agency. Is also like all these constellations they're graphing out with all these various government agencies, which are all part of the same thing. So in the sense, like, I see what you mean, like it's the state that's not trusted, but at the same time the distrust has been disentangling into these RIVM blah 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 organizations. Just like not disagreeing, just like an and kind of thing.
It's very contextual.
Yeah.
Yeah, maybe
To answer the call for the medical anthropologist to say, but I think that one of the things that really struck me was that it really revealed the lack of, so that we've kind of thrown away public health, it's become global health, all kind of trendy stuff. So the actual collective concern or nature of public health, precisely with these QRs and these apps, and it maintained such an individual issue that it revealed that we really don't have a sense of public health anymore, actually, where people don't understand the essence of health as being something collective. But it also, I think, showed that people, so the understanding that policy is a translation of knowledge that involves the priorities that collective concerns raise was not there. But, and also, and I felt that also with students, the mere idea that we actually don't often see the knowledge production happening. So the fact that, oh yeah, yesterday they said this and now they say that, as if that contradicts something being scientific. Also when it's just purely about health, that there is a sense that people just don't understand or are seldom revealed to how knowledge is being produced or how science is being done. It's always the bottom line that that people are exposed to. And health is considered a bottom line. It's good for you, it's bad for you. Or
Yeah. There's someone... Oh, and then Annelies.
Yeah, maybe also to add to this notion of public health disappearing or not not being understood. What bothered me most about the whole QR code was the idea of an easy fix, right? It was the idea like, okay, we can, and I'm very much pro-vaccination, so it's not about that. I mean, I think patents are criminal, right? But vaccines free for everybody is an important part of how I see that we get out of this pandemic. But it's not the only part, you know, it's part of a broader conception of public health. And this idea that in these societies, capitalist, racial capitalism, extractive, and so forth, like recognizing that there is a problem and then trying to find the one easy fix, and then we can go on with literally business as usual. That bothered me the most. And thinking, I mean, it's difficult to think of time in the pandemic, right? But it must have been a month before your first meeting at TTPI, right? Remember the text by Arundhati Roy of the pandemic as a portal into something new. That didn't happen at all. Like that disappeared in front of our eyes. And for me, the QR code was almost a symbol of the disappearance. We're not going to go into something new. We're going to do an easy fix and then reinforce all kind of schemes we already had in mind.
Yeah.
Nice.
Oh my God.
Oh, yeah. Good. Let it all out.
I would like to add to that, it's so much the idea of technology and the higher, the higher technology as a solution of everything. And I think we saw this very clearly by the contact tracing app, because at the very same time as our government completely neglected the idea of wearing face masks, at the very same time they were putting all the energy on this contact tracing thing. It would be solving all the problems. I think that's one thing. The other thing is that what strikes me more recently is the whole turn to e-health and the ways in which not simply the public health thing is falling away, but the whole idea of the public is falling away, because it's so many people are being excluded by this. And I'm seeing this very practically in our own lives, that the way in which you actually have to access now hospitals and you access your portal of your general practitioner, you have to go to the portal.
There is a portal.
You have to go to, if you want to go to have an appointment with the hospital, you have to go to this Mijn OLVG, which you have to enter into. So I'm helping continuously, I'm helping people who have no, and I'm not that savvy, but I mean, I'm helping people who are not particular disadvantages, but who cannot really do this. And there was this beautiful thing we just got on Facebook. I don't know whether it's because of the age category I get this on Facebook. There's a beautiful thing about this person trying to enter into some kind of portal to contact with the medical services. And it said what you all had to do, you had to enter this, and you had to go DGD, and you have to do this, and in the meantime the person was dead. I thought, really, well, it's really, but I mean, this is for people who are relatively, used to using technology. So it's so exclusionary of particular sections of population who will just disengage, I think, with a lot of health stuff.
Yeah, the woman behind you. Yeah.
I mean, mine is a nice follow-up to that, and a thing that I think you've also touched on in the panel is the question of the infrastructures are for whom. And in particular, in the context of the Netherlands, we make a lot of assumptions about technology, who has access to it, the fact that we think that, there is a phone per person with a plan that is always on. Yeah. These are all assumptions that turn out not to be true. And I think one of the things that what has really happened is that it's also become a way to see the tensions and the fractures in Dutch society, a society that is so incredibly uncomfortable about talking about the existing racism here, and it's a sad thing that it takes these infrastructures to bring that out. And the second thing about that is that I feel that discussion also has not been one of a portal where we say, hey, unfortunately, this is what the technology has shown us, and that's the problem we need to be addressing, and a QR code is probably not going to get us there.
Behind you still.
Okay, to try to express this. Okay, I think in the Netherlands, the app, it's the most beautiful design. And I'm realizing now that I find this increasingly disturbing in counterpoint to how ununderstandable and ungraspable the real conversation about the infrastructure, about the politics, about the management is, because there is a certain comfort in interacting with a user-friendly, well-designed interface, and talking about easy fixes and about people that are comfortable with technology, because you talked also about people that are not comfortable with technology, maybe they do not find it so beautifully designed. But for the rest that are, there is a certain comfort and illusion of safety because something is so well UX designed as the Dutch app. And this, I'm now realizing it's in such a disturbing counterpoint to the lack of conversation that is happening here but not happening elsewhere.
The design...
yeah, and it's really... Yeah, absolutely, and it's really interesting because one of the things we've been studying is agile methodologies, and one of the things they do is to say we must be very user-centric, close to the client, etc. But one of the critiques of it is that kind of user centricity is about comforting the user while you remove all the other stakeholders of the system, right? So you mesh that into software production, right? And so what we tried to do, what's happening today is basically what happened in our workshops, okay? So we would try to keep the conversation as deep into the infrastructures as possible and to be very concrete. When the government says, I will do an app, the app needs to run on a mobile system with an operating system. 99% of those phones are in the hands of Google and Apple. So that means in that moment, when the government says, I want an app, their imagination of how to reach their population is hijacked by what Google and Apple has built over the last 30 years, right? So these are the kind of things that we brought in, but then we enmeshed them with exactly the kind of stories you have just brought to us in the last hour from the people who were in the workshops. So this became a method. So we exchanged anecdotes of previous, current, historical experiments with similar and different infrastructures, so we could look at infrastructures in the past or how the communities were affected by them in the past to understand what was happening now. And to just give you a sense of that, we started calling these infrabels, infrastructure fables, basically, but put together into infrabels. And Miriam is going to give us an example of an infrabel.
Yes. So yeah, I was just asking because I have really difficulty seeing you. So Yes, so I actually like the word infrabel because also it's also a Dutch word, fabeltje, fable, and it has different meanings, right? Like in Dutch it has a negative connotation, I think, like kind of fake news, fabeltjes. But it's also a genre, it's also, it can also be poetic, it can also be playing with an actual anecdote and how to make it digestible different ways. So the infrastructure fables, the infrables. So we've, as I said, heard many, and I was like hearing you and I think, oh my God, there's like 3 or 4 that are so good. We need to like include them as the contradiction. So I'm going to read one. The phone I use is quite old, and so I could not download the national tracing app. I could not access some locations because I could not check in digitally. This was during the first lockdown. But it seems that since then, venues have been told they could not discriminate against people without the app and to offer alternative paper check-in processes.
So there's another one. So like as Miriam explained, and we hear there's this shift from telling an anecdote and by repeating them and retaking them and also talking about things that you might not have experienced yourself, but a friend of a friend was at the border, and then this is ways that we realized that we were trying to come to terms with the shifts that we were seeing in the institutions and of the operations that they were more and more moving into computational infrastructure. So this is one of those anecdotes that someone told about someone. It's called Vaccine Bros. So people doing sex work were saying to me, do you have the Vax badge on your profile? And then others were asking, have you seen the taglines on Grindr? People are labeling themselves as Big Bear Pfizer, as Moderna Otters. Some said they saw a profile that was labeled, let me check, it was Grindr profile of a vaccinated top with the foreboding caption, it has begun. It's inevitable. The antibody bro is about to become the vaccine bro.
Yeah, so in the bug reporting workshop, we realized, the moment we started to ask people for these stories, it was like a kind of piling up of anecdotes. So there was this kind of really cascading effect where somebody would tell an anecdote and then somebody else would remember another anecdote and another one and another one, and the density was just kind of amazing, and we really realized kind of, what's happening in this kind of storying or this fable process. And one of the things that we were really interested in as well is how it was working, kind of like a gossip, and obviously there's that kind of history of feminist practices, also thinking about gossip as a type of methodology, but also, it would be like my friend, or I heard the story, or I'm not really sure why it happened, or they told us. So it's also very different kind of relation to, the original source, right, in which we might use to kind of generate evidence about the way in which computation impacts us or our institutions. So the more kind of anecdotes were shared, they became more and more like gossips, stories, legends, fables. And so, this kind of developed out into this practice of infrabels, the fables of infrastructure, as we were saying. And the way in which, we really started to see how these fables could actually also be a type of not just accounting for, but also a kind of reimagining with these infrastructures, and so also been kind of working with them in ways in which they can be picked up by others and rewritten and reimagined. And so that actually the more you kind of tell an anecdote or a story, right, the more extreme it might get. And actually there might start to be some kind of flowers through the asphalt, right, some kind of openings or possibilities in something that generally we might kind of think like, what can we do about this? So that was one of the kind of core things that really came out of that bug reporting workshop. And the other thing I think that was really interesting in some ways is the way in which the bug reporting workshop brought lots of different materials for everybody to kind of take up and work with and research together. And I think, even amongst us as a group, and also the people we're working with, I think that kind of confidence of what might it mean to say something about these computational infrastructures and to get to know them collectively and to be able to articulate and imagine. And actually the realization, I think, that a lot of the people that we worked with was also a kind of realization of their own expertise in a production of knowledge about these things. So, many of the people that we worked with, they were like, well, I can come to the bug reporting workshop, but actually I don't really know anything about the contact tracing app or about the certificate or the code. But actually that kind of realization that the practices that they're engaged with actually gave a lot of expertise really to discuss and respond and think about a kind of addressing it. And in particular, I think, one of the other things that it really allowed is that, as we were just talking about, in some ways a kind of maybe one of the reasons, and this was discussed, that there hadn't been a kind of big like feminist perhaps critique of some of these computational infrastructures that were emerging during COVID is because actually I think many people expressed it would almost be seen to be anti-feminist, like anti-care, to even question. So that kind of right to question or that right to discuss would be anti-feminist or actually a racist position because of the way in which COVID was affecting marginalized groups during that time. So actually kind of shifting from that to actually be a kind of, the right to ask questions, the right to critique, and that also being a feminist position.
So there was a bug report after all of this. So we are obviously not going to go through the bug report because if I see correctly, we have 10 more minutes, or 12, right? Okay, so just to kind of give you some of the headlines that were in the bug report, which was then placed in GitHub, which was used by the technologists who were implementing what was written out in the regulation, in the EU COVID-19 certificate regulation. So the repurposing of e-health infrastructure for managing freedom of movement digitally, right? Because one of the starting points of the regulation was to ensure freedom of mobility within the Schengen area, and yet what happened counterintuitively, or maybe intentionally, we don't know, was that actually public health was used as an excuse to use computational infrastructures to manage freedom of movement. And then eventually this was not just about cross-border movement, but movement into spaces and venues and attractions of different sorts. Growing public-private interdependencies entrenched in an essential infrastructure. I think most public health institutions not only have they not digitalized massively, but they have also not been confronted with this computational infrastructure like that of Google and Apple, and the speedy processes of software production that happens on top of them. So we paid some attention to our public health institutions who have already been scarcely funded over the last decades, ready for this kind of not typical privatization, where not only is their infrastructure privatized, but their practices transformed, changed. Not enablers and informing, but an infrastructure of checks. The expansion of borders, which was referring to the way in which border regimes were brought into everyday life, and racist and classist systems were implemented through these certificates. A never-ending infrastructure, referring to all the measures that were implemented post 9/11 with respect to surveillance, now potentially being repeated in the case of COVID, where the implementation of the infrastructure actually already has had 2 iterations, right? We had the COVID tracing app, which got a lot of protest, the immunity passports, which got much less protest, and now there's an EID regulation that's coming up, as well as potential ways to pivot these apps to normalize the use of your phones for identification or access to resources, just like your login information gives you access to digital resources, but using that very powerful digital infrastructure to give access to physical resources. And we talked about shifting grounds, which is the fact that indeed this very powerful infrastructure, like access control, where it's historically coming from, what is really powerful about digital infrastructures is that you can set policy. So Shifra, what you were saying about like policy, I think you said it is translation of knowledge, right? But for computer scientists, it's just a policy and you apply. And the point is that you can build an infrastructure that can flexibly implement any policy. And we saw, as with the COVID certificates, the policies changed, right? Like there was equivalence at some point between vaccination testing and recovery, and then there was 2G, 3G, I mean, many Gs. But basically, what these technical systems enable is that you can update policy at digital speed in physical space. And that's a combination that I think we haven't discussed enough, what that means, because it actually even disables the party who's using the phone to check your certificate to be sure of what policy they're implementing, let alone having the ability to judge whether that policy makes sense in the context that they're implementing in it. Okay. And then finally, we had one section we would like to read out. Miriam?
Yeah, so the idea of how this sort of the externalization of the policing into everyday life, and also this is also why the methodology of the bug report has been incredibly important when talking with anti-racist organizers, anti-fascist organizers, the production of knowledge, for instance, about the fact that the Netherlands already has for quite some time the koppelingswet, which is a very racist policy that does what you now have in Belgium, where the healthcare is already coupled, so no access for refugees and illegals, as they call it. So this development, this process around the COVID app has really concentrated this problem. And so I'm going to quote for you from our bug report about particularly this idea of how policing bleeds further into everyday life. Since the data in the QR code is available in the clear, this infrastructure has no built-in constraints for who can verify the certificate. Since certificate checks can be expected not only at the border, but could be easily implemented for entering a workplace, a demonstration, or a classroom, it introduces new forms of policing into everyday life. This set of facilities conditions this setup facilitates conditions of vigilantism through the everyday management of citizen movement, organization, population flow, and control. It also potentially demands teachers, health workers, shopkeepers, and protest organizers to act as if they were the police. What mechanisms are in place to limit random checks? What legal and complaint procedures are foreseen to address grievances? How to ensure that rather than supporting freedom of movement, the digital token becomes a tool to restrict movement of people as they go about their everyday life? We invite you, of course, to read the rest of our bug report.
So there's much more to say, but not enough time as usual. But just to this, like when you read it, Miriam, I like my stomach still goes, because this was May 21. May 2021.
The black hole that's called.
This was before this, the regulation, as it was called, was even in use. So once we had together written, and it was surprising that people kept coming back. So we had like afterwards 3 sessions where we had intense writing sessions together to try and articulate and formulate these points that Seda just did because we were really struggling, of course, with trying to say, but what do we actually think this is going to do? We had decided to publish the bug report in the environment that actually this technology and policy was being developed. We had found the repository of the EU e-health network. Thank you. I have the second very good.
Too many words.
Too many words. That was publishing its code and standards on a public, let's say, a publishing platform. Miriam said, say that it's like peer review for software developers, then they will understand. I don't know, whoever they is, exactly.
Academics.
So this is a place where people doing technical development will post their code in the making so that others can do things like bug reports. So it has a whole system around it for actually catching bug reports and the responses of the developers to it. And we were really clear that we wanted to have it there because we wanted to we were absolutely convinced that this was a discussion that was related to the technological object, and we had something to say about that. Of course, or not of course, within 5 minutes after posting the report, the maintainers of that repository decided to close the issue because it was a non-technical concern. And they moved the bug report that was clearly crafted with much precision to the section general discussion. Yeah, I give it to you.
So that was kind of disappointing. Did we? Yeah, we obviously, like, there was back and forth about, and then there was even a Twitter thread whether our bug report was technical or not. And no, of course. Yes. Yeah. We can provide the link. So this particular bug report did not get, as you can imagine, the kind of public attention we had been used to with our only other report, which was the contact tracing app bug report, which actually was both welcomed by the team of researchers and developers that had their own GitHub as well, and actually caught quite a bit of public attention, to the point where a lot of activists and organizers and academics reached out to the Institute to speak about why we had written the bug report or bug reporting as a method. Now, this didn't happen with the immunity passport or COVID certificate bug report. However, something else, which was also quite beautiful, did happen, which maybe is also in the difference. In the first bug report, it was the 4 of us who wrote. I didn't sign it because I was also part of the project that was developing the privacy preserving protocol, but they didn't know that I was. Anyways, don't tell the interwebs. Okay, but I think by virtue of having worked with the wonderful people who joined us in the workshop, for which we also had a lot of considerations about ethics and time and funding and how participation would be organized, etc. It became, the bug report itself became a starting point for formulating further critique. So just to give you very specific examples, one of the groups that we had been working with, who does sex worker organizing, they then did their own meeting where they talked about the experience of sex workers on these platforms and with immunity passports, and how also the increased use of identity on some of the platforms that sex workers use impact both their safety and their ability to do their work. And another group ran their own workshop, actually in collaboration with us, where they started reworking the infobells, making more fables out of fables, which we were going to read to you, but we're not going to because we're now out of time. Okay. And yeah, I think what was also very important is that there was this possibility to survive EU regulatory documents, as well as read into the details of technical documents, together with people who are neither policy people, regulatory people, or technical people, which was really wonderful, and really an old practice in feminist computing, computer science, of saying, you know, who is the expert in the room? Can we question that? And I think that understanding of the latent expertise allowed these groups to then continue exercising critique in what would be otherwise, could be seen as technocratic hell. Yeah, I think that's kind of... No? What?
I think we should read. It's just a few minutes. It's a wonderful infobell.
Okay.
Yeah. You
have your microphone.
Okay, I have my right. So one of those extra iterations that was happening in Rotterdam at Varia, where we brought this discovery of what happens when an anecdote gets taken up by others and reworked. We experimented with that. It even involved a piano, but that's not for today. And we will read you one of the infobells that came out of that. It was like, okay, I can help you. Right. In the work that I do, the organization uses Microsoft Teams and Zoom. No, it was Teams, I think. What's the difference? In the first meetings I didn't want to install the app or program on my laptop, and so in first meetings, I joined straight from browser, the Teams or Zoom, House Party, Jitsi, or was I on TikTok? I don't know. In the first meetings, I was just staring at the icons, wondering why everyone was refusing the camera. In the first meetings, even the head of the organization didn't have a camera. In the first meetings, I was still working, but I gradually just relied on no camera too, taking the meetings from bed, from the floor, from wherever I felt the fuck comfortable. I started to really change the work I was doing, and I started to dream of the abolition of work. I mean, before, when we all had to sit in those team meetings and see each other's faces, all encouraging each other to work. I mean, I started to build like a beaver's den or like a badger's burrow near where my desk would be. At one point, I just took the desk, broke it down, and burned it outside. I mean, I started to do my spreadsheets as if I was a beaver, and before long, I pretty much realized beavers don't care about spreadsheets. It took me some meetings to realize that that was the reason why I couldn't see my colleagues' faces, because the software, I think it was Zoom or Jitsi, or was at that time, I got invited to Career House on Macedon. No, sorry, it was Team, I guess. Allows you to see other people's faces only if you install the program. I had only FaceTimed with my mum once a week until that day, and she could see my burnt desk. You know, when your mum answers the video call and you still cannot see her face because the phone is so close to her face. What if I hadn't seen their straight faces for the last 12 months? I think I'd rather not have seen my colleagues' faces all semester, sleepy or full on makeup on and showing off pajamas and eye bags, but mostly my own nap face was there. During the month of not seeing my colleagues' faces, their faces slowly changed. After the installing trading space on my device for faces, their motion changed. Whatever happened to phone calls? No file to save after, no records, no tracks. I'm so paranoid these days, it really freaks me out. I never got the invite for fucking Clubhouse. Thank you, Varia in Rotterdam, for hosting this workshop.
Yeah, I think we should.
Yeah,
I guess. I think the spy needs us to stop, right?
Yes, let me then just.
Yeah, let me take this out.
Just half a minute to say thank you so much, and clearly also watching at the time and the audience, clearly we need more of these conversations, so let's brainstorm how we can have more of these. Thank you so much.
Allah.